Welcome back, everybody. Let's talk about your skin, whether it's acne or super dry or other more severe situations. We got Dr. Jason Hadley here, a dermatologist with Ogden Clinic, but you're in the Bountiful office. So let's talk about that first.
Sure. So
Ogden Clinic is much more than just Ogden now.
it is. It's really now becoming kind of a northern Utah phenomena. It's been open since the 60s, and recently the Ogden Clinic has been expanding into Pleasant View and into Roy, and now recently into Bountiful, which is where I'm located with my brother.
Fantastic.
Dr. Hadley, what are people coming in for right now? What do you see the most of in your office?
Well, the garden variety things, mole checks, certainly acne, lots of acne. That's something that plagues a lot of Utahns.
All right, should we jump in right there? Should
Sure.
we jump into acne?
Yeah,
Yes, please.
why not?
What do you do? I mean, are you saying you're seeing teenagers or adults?
Well, you know, acne is something that affects 80% of individuals from age 11 to 30, so there's a lot of people with it. It's not just a teenager thing. And while over-the-counter treatments can work for a lot of people, for a more comprehensive fix, generally getting in to see your Board Certified Dermatologist can provide those things that maybe are individualized to you. Sometimes we're able to help you with just topical products, but sometimes you require systemic things. And one of the nice things that a dermatologist can do is perhaps identify underlying triggers that are causing your acne and work with you to improve that.
Fantastic. I'm turning 30 in a couple months. Does that mean that my acne is going to go away?
Not necessarily, not
Okay.
without help. Yeah, I think that was a myth that was told to us all in our teenage years. Yeah.
That will grow up and it'll disappear.
Yeah, no, unfortunately, not necessarily. But I think together with a dermatologist, you can develop a plan that will definitely improve it.
All right,
Fantastic.
You mentioned mole checks. How often should we be doing those and that all-over body skin check?
Sure. You know, that can really be daunting, you know, to get into a dermatologist and have them look you over head to toe. But currently, we're recommending a yearly skin check. That's one of the better things that you can do, not just for your skin health, but your overall health. And it's really a simple process. You get in, we put you in a hospital gown, and we systematically look at your body. And oftentimes, we're able to tell those moles that are just fine, and sometimes we're able to find those that are problems and intervene.
Now, is there something we should be looking at in our own moles, even when we're just in the bathroom getting ready for the day? Is there something that's a major red flag?
I would say, if you could take one rule from me, is if you see a mole on your body that does not look like any other mole on your body, that's a big red flag, and that's something that should be brought to the attention of your dermatologist.
Does color matter when you're looking at the moles?
It does. Again, I would go back to if the color of that mole is different than the color of your other moles, please bring that to our attention. But certainly any mole that has multiple colors within it, or that has irregular borders, that can be a big red flag.
What I love about this all-over body check, because I've had it done a couple times, I spent a lot of time on my trampoline
Sure.
with baby oil
Yeah.
and sun in
Yeah.
as a teenager, and a lot of us did. I mean, a lot of us were in the sun. They go up into your scalp, in your hair, in places that you can't reach and you can't see.
That's right. We look between toes. We look at the backs of your legs, which is a very common place to have cancer, and you bet we look at your scalp as well. And oftentimes you're able to leave there in 20 minutes with peace of mind, and you know, and other times we find problems.
Okay, really quickly before we go, can you diagnose serious illnesses and maybe prevent them from looking at someone's skin?
Absolutely. The skin is really a window to what's going on inside your body, and sometimes a rash is simple and sometimes it's complex, but being able to see it, evaluate it, sometimes we're able to intervene and take care of problems before they become big problems.
All right, the Ogden Clinic dermatology information is right there on your screen, along with their website. We can link you for Mars and their phone number. Dr. Hadley's located in Bountiful, so go say hi to him. Thank you so much for being on the show.
Thank you for having me.
Thank you very
Appreciate that.
much.